This is fantastic. You may not know, my name is Dane Peterson. I'm the interim CEO here at Emory St. Joseph's Hospital, also the hospital group president for Emory Healthcare. Absolutely can't believe that I get to do this in the first week that I'm here on campus. What an awesome deal. Also, I used to work for Ford, so that whole car thing is absolutely in the blood as well. And so having Tesla and all of that innovation that Tesla's bringing with really two very exciting physicians that have taken this on as a mission. Last year, 1 day, this year, 10 days, next year, 10 days. Always think of St. Joseph's as your partner. Come to this campus anytime you want. We will be here with open arms. What you're doing is so important to give men the opportunity to say, you know what, maybe it's not my wife or significant other that has to force me to the doctor. Maybe I can do it on my own. And so that's what today's all about, is the access, understanding what we need to do as men to keep ourselves healthy. So we have a really great folks here to talk to you. We do have some Winship Cancer Institute faculty and physicians that'll be here. Dr. Semino, Dr. Pateris, Dr. Rossi will be here to talk to you, everyone else here. So we're gonna have a great afternoon, and I just thank you so much for being here on campus. I'm gonna hand it over to Dr. Semino. All right, thanks.
Hi, I'm Kara Semino. I'm a urologist at Emory here at St. Joe's campus and also at the main campus. Just wanted to talk a little bit about an issue in men's health that not everybody talks about, which would be erectile dysfunction and sexual function. So a lot of the things we do to help cure men of prostate cancer can impact sexual function, and I think it's a little taboo to talk about it, and I think it's a really important thing to bring up to your doctor if you have issues with it. And I don't think a lot of men realize that there are a lot of interventions that we can do to help improve erectile function after prostate cancer or just erectile dysfunction in general. So just like the Tesla has a wonderful engine and has an amazing body and build and parts, you know, you have to have, your penis has to have the equipment there to work too. So you have to have good blood flow, you have to have a good nerve supply, you have to have intact penile structures. There's a lot of things that go into actually getting an erection. It's not that simple. So you need to have, at the base of it, good health. Anything that's good for your heart, anything that increases the blood flow to your heart, increases the blood flow to the rest of your body. So the most important thing when thinking about, erectile function is if you're healthy overall, your erectile function will be better. So doing the smart things like eating healthy, working out, good cardiovascular habits, controlling your weight, all of those things, controlling your diabetes, controlling your heart disease, controlling your high cholesterol, all of those things improve blood flow to the penis and improve your erections. And so, that's the one thing you can do that doesn't cost anything and is good for you and can improve your erections. But then also, if you are having problems and that's not adequate for it, there are plenty of interventions we can do. And so, people hear about the little blue pill. There are medications called PD-5 inhibitors that can help improve blood flow to the penis and help you maintain and obtain an erection. There are some side effects, and so you need to talk about a doctor before you use that, but that's very beneficial for some people. Additionally, there are suppositories, so I'm going to talk about all these things that no one wants to talk about so that you know they're out there. But there are suppositories that you can put into the tip of your penis that help dilate the blood vessels in your penis and improve blood flow and erections. And I don't think many men know that that's out there. And similarly, the next step up from that would be something like an injection. So there are medications that you can inject directly into the penis that help you get an erection. And these are very beneficial, especially for men after prostate cancer who have had an impact on the blood flow to the penis and the nerve function of the penis. These interventions can help them. And there's vacuum devices that are mechanical devices that can help obtain and maintain an erection, as well as, and this is kind of the end of the line sort of thing to do, but it's very helpful and people are very happy with it, that you can undergo surgery for an implantation of a penile prosthesis. This is an inflatable device that when you want an erection, you can pump it up and get an erection, and when you want it to go away, you can push a release valve and the erection goes away. And it's obviously a lot more complicated than I'm making it sound right now. So you should obviously have a conversation with your doctor about this before you went through with it. But men tend to be very happy with it. And I think the point of this discussion for me was that I wanted men to know what was out there, because I don't think a lot of men know that all these options exist, so that you can have a conversation, you can talk to your doctor about, you know, the things that you can do to improve your sexual health, which is a huge part of, you know, your happiness and wellness. So this is just, you know, a snippet of a conversation about, you know, what options are out there. But I just wanted to make sure that this is a topic that's brought up, you know, take away the taboo of it. If you have problems with your erectile function, whether it's from, you know, surgery or anything else, talk to your doctor about it. There are lots of things that can be done, and there's no reason to be embarrassed about talking about it. It's a big part of your, you know, health and wellness and happiness as a human being, and, you know, there's no reason why you shouldn't be able to get help for that. So I'll take any questions if anyone has any. Otherwise, I'll pass it on maybe to Dr. Pateris or Dr. Rossi, whoever wants the hot seat next.
I'm Peter Rossi. I'm a radiation oncologist here at Winship Cancer Institute, Emory St. Joseph. I want to send our appreciation to Dr. Brambach and Dr. Pericatillo for bringing your Men's Drive for Health to our campus, for bringing your Tesla here, but also your great energy and your great passion for what we care about so much as well. It's really an honor to have you here, and we'd love to be participate further, and we're going to follow you through the next 10 days of your trip. Just to introduce myself, I'm a radiation oncologist, and I specialize in the treatment of prostate cancer. Just like in Orlando, as in here, it's the specialty, and it's the men that we care about the most. Just to tell you a little bit about our program, we have a highly specialized treatment in brachytherapy and robotic surgery and external beam radiotherapy, but that just touches on it. What we do is specialize in prostate cancer and with a focus on the individual, on the man, and on the men's health that surrounds it. So I'm going to talk for a couple seconds today just on tips for survivorship, and I'm going to focus mostly on just how diet and exercise influence survivorship. And just in general terms, when you have a positive diet, when you have a positive workout session, a physical exercise routine, you're more likely to survive cancer. You're more likely to tolerate treatment. You're more likely not to have these side effects that go along with cancer therapy, whether it's surgery or radiation or chemotherapy in the traditional sense, and you're more likely to have a high quality of life long term. And how we approach that is with a very large team. When you visit us here at Winship Cancer Institute, like many of the NCI designated cancer institutes in the United States and cancer centers in the United States, it starts with the excellence in care of nursing and oncology nursing, the courteous for staff that creates a positive environment for you. It has to do with the nurse navigator support that can help a patient be directed from beginning through survivorship, the expertise on staff from pathology and radiology, and all the supportive staff through the surgical professions, the radiation oncology and chemotherapy. And along the way, you'll generally meet a nutrition or dietitian or an expert in these areas. And what I want to focus on is just a few key points to you today. One is diet matters. When you adapt a diet for survivorship, you are going to improve your quality of life. You may live longer, and it's really focused on a diet that goes for the good things. And I kind of generalize it in a Mediterranean diet. And the good things being healthy, whole foods. Simple tips are shopping the outside of a grocery store and avoiding the stuff on the inside that is more processed, has more preservatives, stuff that is higher in animal fat. And we like to focus towards such products as soy, such products as tomatoes, such products like turmeric, that we've studied these nutraceuticals and know that they benefit our patients. And those are benefits you can see actually every day in people undergoing treatment. And this is clinically proven to prolong life. And then the second thing I want to talk about is exercise. And very simply, any activity benefits our patients. Just being outside like this and absorbing and processing for your vitamin D is an important point to healthy survivorship. But the data supports this. It is not even an arguable point. When people just walk 20 minutes a day, or get in a pool for a little bit of time, or do something deliberately, not to be a marathon runner, but just to get their heart rate up a little bit, they are going to benefit themselves. And there are such things as studies we've done and completed where 14,000 men went through this prevention test, and when we were looking just at whether they did something for 2 or 3 hours a week versus were doing nothing, they had a 30+ chance reduction in their recurrence of prostate cancer just in that alone. And so we know that the benefits are profound, and that's what we want to relay to our men and to their families for their survivorship. So that's my message today. Thank you for your time, and I can field any questions as well.
I really want to thank everybody for coming out. Cijo and Jameen did this last year, and they asked me to come and talk, and it was really interesting. I was like, what are we going to be doing here? And they said, well, we're driving an electric car up to New York, and by the way, you were invited to this fancy party up in Manhattan. I said, oh, that's wonderful. So I said, well, we're going to meet, and we have to hit superchargers. And for those of you who don't know about Teslas, they're an electric car. You can't get gas, so you have to go and get them charged. And you basically have to go up these superchargers, and they're up the coast of 95. These guys actually have sort of figured it out now, where Atlanta's become actually the biggest market for electric cars on the East Coast for a lot of different reasons. And so now they were kind enough to come towards Atlanta, so I didn't have to drive out to Savannah last year. I have my wife and daughter here, and they will attest the fact that we drove last year, and we went to Savannah International Airport. And I don't know how it's an international airport since it's so small, but this is a much better venue. Yeah, there you go. So my whole point is I really want to thank the people at Emory St. Joseph's for really helping set this up. Between the work that Ansley's done and Heather Dexter and everybody else here, and having Dane here is really, it's wonderful, because my role at Emory, having been with the Emory system for 15 years, has been up here for about the last 2 years. I sort of followed Peter Rossi, who's a good friend of mine. When he was moving his practice up here, we felt that this would be a good opportunity for us as urology to come up to St. Joe's at the time, and now Emory St. Joe's, to really build out what we want to build out. And I can say it's been nothing but a warm welcome and invitation, but I really want to thank all you guys for really making this and setting this up, and the fact that I don't have to drive to Savannah and stay in an airport. So I really also want to thank these guys, Cijo and Jameen, for coming up. It's pretty impressive what they've done. So I'll go over with the thank yous and go through it. But I think what they've done from a social media standpoint and an awareness for men's health is really important. It's something that I hope we can really continue in the Atlanta market, especially through Emory, Winship Cancer Institute, Emory St. Joseph's, of course, my new home. So I think this is something I think we need to continue to do, and I will support you guys. If you're going to the West Coast, I'll figure it out. Europe, all right, I'll be the guy in Greece for you guys in Europe when you go to Europe too. So I'm up here to talk to you today about urologic cancers. So maybe not as much a men's health topic, but when people think of urologists, they just think of men. But in reality, yes, I have a lot of male patients, but I have female patients as well. So we'll talk about men's health, but at the same time, there is a lot of overlap. As we know, women are really getting a lot of these cancers, all except for prostate cancer and testis cancer, of course, but they're actually an increasing rate of cancers amongst women as well, just because of lifestyle issues. So urologic cancers, urologists, especially what we do, which is a little different than a general urologist, we treat cancers from basically all the way from the top of the kidneys all the way to the tip of the penis. So yes, we've heard the word penis a lot today. But one of my topic was minimally invasive surgery. And one of the things that St. Joseph's was a pioneer, even back in the day when I was down at Emory, was robotic surgery. The robot is basically, it's a tool. So I always tell people, the first thing I tell them, they're like, oh, the robot's going to operate on you, the robot's going to do this. And I'm like, no, these guys use it just as well. It is a tool, and there's a person sitting on the other side of the robot, but it's a really pretty impressive tool. I really was not enamored with it at the beginning because I thought it was all marketing. That being said, some of the things we can do with the robot, I think patient outcomes and such has really helped out. So for urologic cancers, we deal with adrenal cancers, we deal with kidney cancer, we deal with renal pelvic cancer, which is kidney cancer of the inside. We deal with testis cancer, which basically is very fast grinding and affects over 8,000 men a year that goes into the abdomen. We deal, of course, with prostate cancer, the #1 cancer afflicting men, 220,000 plus cases a year. So I think that's really where the robot was designed to be a heart surgery device and really became more of a prostate cancer surgery device. And then there's all sorts of other cancers involved, but basically they're all very, very different cancers. And I gotta say, the support I've had through Winship, and of course Dr. Rossi and the medical oncologist, I mean, this is a team effort. One thing that we really do when we do well here is, especially in our multidisciplinary clinic for prostate cancers, we don't have patients come in and say, you're gonna have robotic surgery, you're gonna have radiation. We give them options. We discuss with them. We have wonderful pathology with Dr. Sears standing right there, which really helps us diagnose these patients and try to offer them really the best evaluation for what we can offer them. So basically, the minimally invasive part, while some people don't believe it, is actually really important because it allows the patient to recover. It allows them to get on to other treatments. So for adrenal cancer, there's only about 200 reported cases of adrenal cancer a year, but some of these patients need chemotherapy or therapy right away. We can do that laparoscopically, we do that robotically. But I mean, I can tell you, I can get a patient home and overnight surgery for something like that, just like I can with kidney cancer as well as even prostate cancer. It really allows a patient to have a better mental outcome, but also not having big, huge incisions and big blood loss and all these things really allows better well-being for the patient. So let's talk prostate cancer, because we have a limited amount of time here, and this is one of the ones that a lot of people know about. I mean, Dr. Rossi and I see patients that 5 years ago would have been told they can get hormones and that's it. We are now seeing these patients, we're now operating on them, knowing that they have advanced disease, and the advantage of minimally invasive or robotic surgery is we're able to get to do very large operations, where in the days I used to make incisions maybe all the way up to the ribs. Just to do the same thing I can do with 5 little holes. And with that, we can debulk these patients. We can actually get them out of the hospital in a day. I mean, sometimes just overnight, sometimes a couple days in the hospital. But then we know when they need hormones, chemotherapy, or radiation, we're not waiting a long time for them to recover from their urinary control or other issues. They're not going to have really good erectile control with some of these more aggressive patients. But we can get these patients onto radiation a lot quicker with better outcomes, we feel. So that's one thing that we've really taken is, what we have here is also a very high-risk prostate cancer program. So we're taking men that would have been written off years ago and actually helping them out. Now, the one thing we're not doing is we're not operating or radiating everybody either. So it's a really important thing that men, I would tell everybody, almost every male will have prostate cancer, but not everybody needs to be treated. I mean, most of us will get it, most of us will die with it, but not from it. So one of the things Dr. Rossi and I, and Dr. Sanda, of course, have done is we've also set up a very active surveillance program. We do that with kidney cancer as well. These are where we can actually see patients, diagnose them, assess their risks, and tell them whether they're going to be, have an increased risk of this cancer causing problems or life or death situations, or this is something that we can watch. And for a great deal of these patients, we can watch them. And that's really done just with office visits, blood tests, biopsies, and such. And it's really important to have a good multidisciplinary team that bites into this. So we're not really putting people into surgery that don't need surgery. We're not putting people into radiation that don't need radiation. And it's really quite important. My other big role is I came to Emory to start the minimally invasive kidney cancer program. And interestingly enough, and I gave a quick talk about this last year as well, is that kidney cancer is actually now on the rise, on a huge rise. We're now seeing, when I started, it was about 35,000 patients, and around the year 2000, it's around 62 to 63,000 patients. I saw 3 people this morning, ages between 35 and 55 with kidney cancer. So it's even hitting the younger populations. But the good news is we're finding these tumors because of other reasons. I mean, 2 of them today showed up for kidney stones. They do kidney stone checks, they found a stone on one side and they found a tumor on the other. But we're able to save kidneys, and that's actually a really important role that the robots help me as well. We don't go in and take out tumors. We don't take out the entire kidney anymore. In fact, that's pretty rare for me to do. It's one of the least likely operations I do. So with robotic surgery, we're able to go in and actually spare. As long as we can save half a kidney, we can go in there and really cut the tumor out, reconstruct the kidney, and then put it back together. We sometimes have to still do this as open surgery, but we can actually do it robotically, I'd say about 85 to 90% of the times in most people. Not every patient qualifies. There's just different degrees of cancer, just like all as it is. The other thing that we also do is ablation therapy, which is something that I've been doing for at least 15 years now. And that's something where with kidney tumors, unlike prostate cancer where you can't see it, kidney tumors, you can actually see the tumor. You can see the tumor on the CT scan or the MRI, and once you get in there with little tiny scopes, you can see the tumor as well. So I brought a very active ablation program here, and ablations are actually very good for patients that may be a little bit older, maybe have one kidney, maybe have some renal problems, kidney problems already, and where they do have a tumor in their kidney and it needs to be managed, but more aggressive surgery may damage the kidney and kidney function. So we're able to go in there with 2 or 3 little holes and actually go towards a tumor, put some needles in, freeze these tumors, and the 15-year actually outcome data has been very good in my hands. So I'm very thrilled about that. I continue to do that at Emory St. Joseph's. Overall, as I tell people, there's not everybody qualifies for minimally invasive surgery. I have partners that are maximally invasive surgeons, and they do a wonderful job, and believe me, they help me out a great deal. Sometimes I need to send the patient to Emory University Hospital. Sometimes I need to send the patient to Grady Memorial, where my partner is. That's the great thing about actually the thing that I've realized at Emory is that none of us really know. We all sort of know our limits. So if one of my partners can do a better job, I prefer that patient to go see my partner, even if they are down at Grady, even if they are at the main campus hospital or at Midtown. And we do have outreach, and so that's been a really impressive thing about Emory, is having all this. So I really once again want to thank you for coming out on this beautiful warm day. The weather held out, and I want to thank these guys for driving all the way up from Florida, and they have a big trip in front of them. So I know they've got some things to talk about. Any questions, please track me down, unless you have any things. If you need to see us, everybody knows how to get in touch with us, but I will hand it over to...
No, you're still going to stay. We could have all the speakers up here. We just have a few questions from our social media feed that we're going to be asking you guys. Rockstar. Where's our third rockstar? We'll just get down here. I think it'll be easier, right? We'll just have a sitting conversation. Ooh, this is hot. All right. So I want to thank you guys for that was amazing educational lectures, and that's what we're trying to do is get local drivers. So I'm so excited and happy that you guys are our local drivers for the Drive for Men's Health and promoting the cause, which is men's health. Now, statistically speaking, I'm going to emphasize these points again. I know they were brought up in some of the other ones, but in 1920, there was only a 1-year gap in life expectancy between men and women. Can anybody in the audience guess what it is today? The gap in life expectancy between men and women. My crew can't answer. 10? If we don't do anything, it will be 10. But now it's 5 years. So with the latest technologies that we heard about, the newest medications, the best hospitals, the best doctors, the best support crew, guys are just lagging behind. If you think about the top 10 causes of death in America, top 10 causes, can you guys guess how many of those men are more likely to die of? 9. That is astounding. So what we always tell people on the road is your body's kind of like a car. So do you drive a nice car? You don't have to say. I mean, I drive a minivan, so I mean, you probably drive something a little bit more exotic than that. But your body's essentially like a car, and that's what I tell my patients. But your car, just like if your warning light goes off on the car, or your engine light goes off, or the tires get deflated, what are you going to do? You're going to go to your Costco where you have the warranty, or you're going to go to the next local dealership to get everything fixed. Your body's essentially the same way. When you have a warning sign like a rash on your skin, blood in your urine, a headache that just won't go away, you need to get yourself to a doctor. But your body's also like a car in that there's certain maintenance. And you can be as young as 20 or as old as 100, but there's certain guideline-based things that you have to do with your primary care physician and specialists to get yourself screened. So it's just blood pressure checks or lab tests or just going and shaking your doctor's hand. So what we found is, I think that's the biggest problem is we have really good care, really good resources like you guys have here at this institution, but how do we get guys engaged? How do we motivate them? So I wanted you guys to tell me about what you guys are doing in your practice and what is something that we can learn in the Drive for Men's Health. Maybe we can take some best points to see what you guys do to engage guys, and not only guys, but maybe all the ladies that we see here, get the ladies involved as well.
Well, I think you bring up a really great point. Since we all see so many men, but especially what I deal with cancers and as well as Dr. Rossi, we find that men are very indifferent sometimes for their health. We see all these people that, won't get screened for prostate cancer, and it's very, very debatable. And part of the problem is that there's a lot of misinformation, in the news and online. But once you get their wives in there, all of a sudden, things change. I can tell you, let's just take non-cancer, enlarged prostate, urinary problems. I can't tell you how many men, I'm sure Dr. Semino and I see, that come in and you go, so how's it going? How are you doing? Great, no problems at all. You have them fill out a questionnaire. We have what's called a prostate symptom questionnaire. And low is good and high is bad. And they're just scoring out of control. It's just, and you go, but what about this, and they all think it's normal, and it's not necessarily normal. You got the guys that come in and say everything's fine until they bring their wives in, and once they bring their wives in, they're sort of...
Then you have to extend your appointment to an hour with that patient, because then the questions are coming.
So yeah, I mean, even from a urinary control issue, because some of these things, even benign issues that we have in urology, stones and obstructive prostates, can cause some really deleterious side effects. I mean, stones can kill people. Enlarged prostates can actually damage kidneys, damage bladders and such. So, when the wife or the significant other shows up, you see that other side, and men are just not very good about doing that. So I've actually even told the industry that's out here, I said, sometimes for men's health, you actually have to go after the wife. For BPH, for benign prostatic hyperplasia, you have to actually, it's her who hears him getting up 3-4 times a night or waking her up and such. It's not just the dog waking him up. But I mean, I hate to say it, men are just not that good. I mean, I operated on a gentleman yesterday for prostate cancer. I have this 35-page handout that I give him. And for men, you got to realize, I got to give it to him in writing, and they don't read it. And his fiance just found out about the surgery on Sunday. And so she was telling me this, and I thought, wow, what a great story to tell. And so she read it 3 times. And I'm glad she did, because there's kind of a lot of important things in there. But that's partly. I mean, getting significant others involved, getting men to understand that they can go to the doctor, things like you talk about, getting some of this misinformation about prostate screening. As I said, you can have prostate cancer. Doesn't mean you need to be treated. Let's find it. Let's find out how bad it is, and then hopefully then we can work on some sort of plan if that's one of the things.
Thank you, Dr. Tires. So you bring up a great point, and we actually did a survey through Orlando Health, and we asked guys 2 easy questions. So you guys are gonna have to guess what the numbers were. But the first question was, what was the make and model of your first car? Okay, can you guys name your first car?
Subaru Legacy.
Subaru Legacy. I don't know what that is. It may outage me, but
Oh, it was a 1976 Datsun 280Z.
what was yours?
A Jeep of some sort.
A Jeep of some sort.
That's how it wasn't answered.
The second question was, when was your last doctor's appointment? And for all the video that's being filmed today, I will not ask you guys that question. But the statistics show that over 80% of men knew the make and model of their first car, and we proposed this question to 1,000 men. Can you guys guess how many men remembered their last doctor's appointment? It was half of that, about 50%. That's amazing. And I asked myself that same question. I was like, oh man, let me look in my calendar on my phone exactly when I last saw the doctor. But I can remember my first car was a Toyota Camry, and I will never forget the look on my mother's face when day 1 owning that car, I got into a little fender bender outside Dunkin' Donuts. But we'll never forget that moment. But you bring up a great point. We have to get significant others involved. So even though the title of this entire endeavor is Drive for Men's Health, it really is let's drive families and partners and females and anybody that loves men and has a man in their life that they love to help change and drive that change that we need in men's health. So the other question was, I know we talked a little about erectile dysfunction, we talked about some other diseases, but what men don't realize is the car is not just the engine. The car is not just the wheels. The car is the actual entire car. You have to take care of everything. So things like erectile dysfunction, a lot of the time, can be completely prevented by taking care of your heart. So what we need to get guys to understand is, it's not just erectile dysfunction, it's not just prostate, it's not just urology, it's the entire body. So you have to take care of your heart, your lungs, your brain. So how do you guys get that into a guy's system? Like, how do you explain to them that the problem is not your erectile dysfunction or your prostate cancer or your issues with urinary tract symptoms, it's really your diabetes, or it's really that heart attack you had 5 years ago. So how do you get that into their head that it's not our fault, it's actually the whole, all of the medical morbidities that you may have?
Yeah, I mean, I think just talking to your patients about it, pointing it out and saying, yes, I can help you with this, but you can help yourself by addressing these other issues. I think just the more you bring it up and the more you discuss it with patients that it's a whole body issue, I think the more that it drives it home. I think people do want a quick fix. I think people want something that they can just take in and fix it, but you have to put in some work too. You have to, take care of yourself, lose the weight, eat healthy, all of those things. And I think just the more repetition and the more times men hear that and hear that, it all ties in together, I think that's, repetitiveness is what you need.
That's awesome. So Dr. Rossi, do you have any medical gear? So what do you guys think about technology? So we're using this Tesla. So I don't know if you guys know the story. Dr. Kyle is very humble. That's actually his Tesla. And what would happen was I felt a little unloved when he got the Tesla, because we would go out to dinner, park the car, and then he would have swarms of men and their families come and ask him what the car was, and I would get left to the side as explaining how amazing this vehicle is. But then those conversations essentially led to, what do you do for a living? And then the conversations led to, I'm a urologist, and then they led to, wait a second, I'm having a little trouble peeing, or I'm having these issues, and then we got them engaged and talking. We're like, holy smokes, these guys want to talk about their health, and then their wives would come in like, go make an appointment with them. But the whole point is not to make an appointment with us or anybody, it's to get guys engaged and start thinking about their health. So that led to the idea of Drive for Men's Health. Let's use this car and various technologies such as our Apple Watches. Last year we had Google Glasses, we have Google Glasses, Hangout. All this technology is there basically to get guys in. Yeah, we love toys. As you can tell, he loves Facebook, I love Twitter, we love social media. But these are powerful things. So I don't know how many patients you guys see in your office, but I can see maybe 40 a day. I can impact 40 lives. But one tweet on education. So I tweeted recently about guidelines of how often a patient based on his age should see their doctor. That had over 10,000 impressions. So there were 10,000 eyes. Now, how many of them actually digested, I don't know. But a matter of a hot second, we can get to 10,000 people. And this drive has already been publicized nationally. We've reached millions of eyes. And media usually doesn't always like to cover men's health topics because the demographic is usually female, but this is one cool thing that we're getting everyone on board to essentially come together and drive that change that we need in men's health. And it's just not just women's health, it's not just men's health, it's overall health in the United States here and then globally as well. So thank you guys, another round of applause. That's right. Let's go right in.
See you again, say too much, yeah? This is a pretty cool thing you guys did. So you're driving it all the way to yourself? You drive the whole way, or you pick it up? Or?